Today we will talk about the heat balance. Actually, our body temperature is controlled by many is our system or our internal environment is controlled by many regulatory systems. One of these important systems is a system for regulation of body temperature. It is a very powerful and critical system that maintains the body temperature at around 37 degrees. Before discussing the heat regulatory system, we must know that there is usually a balance between heat production and heat loss, thus the body temperature remains constant. What are the sources of heat production in our body? The sources are muscular exercise. If we do muscular exercise, our heat production increases very much. Sometimes in severe muscular exercise, it may reach 40 degrees. Also, the food intake, as we have discussed in the chapter of the metabolism, the energy metabolism, heat is produced by the specific dynamic action of food. Also, the basal metabolic rate, which is the metabolic rate or the energy production by the activity of all body system. Hot weather, we can gain heat from hot weather, from hot environment. Also, some hormones are called thermogenic hormones, which can increase the metabolic rate inside the body and leads to increased heat production, like catecholamines and thyroid hormone. Also, we can get heat from the sun, and so the sun radiation is a source of heat production. The source of heat loss. So, how we maintain our body temperature? As usually, the heat production is associated with heat loss. The roots of heat loss include the skin. Usually, we lose 85% of our body temperature of the excess heat from the skin. By the respiratory tract, we lose about 14% by the respiratory tract, and this is by that the inspired air must be warmed too, because it's usually lower than the body temperature, and this may damage the lung. So usually it is warmed while it passes through the respiratory passage. And also during expiration, the evaporation of water from the surface of the mucous membrane needs energy, because it must be heated at first, and this is achieved by the lining of the respiratory tract. Also, the body excretion, usually the urine or the food, is a source of heat loss by 1%. So this is the roots, from where I lost the heat. But how the mechanism? By conduction, convection, irradiation, and evaporation. And these mechanisms are affected by, first, the temperature gradient between body and the environment, and then the in current, and then the humidity, and then the clothes. So let us imagine how the clothes can be a factor which may decrease heat loss or increase heat loss. For example, during cold weather, we put excess clothes, this to prevent the heat loss from our environment to this cold temperature. In case of humidity, the evaporation of sweat is decreased very much, because already the air is saturated with water vapor. So the heat loss by sweating would be decreased very much. Air current, if we use fans or air conditioning, this makes the increased heat loss, as the air which is close to the body will be heated, and it will be get away by the air current and replaced by cooler air, which will be in which we can lose heat to it, and then it is removed away, and so on. So it helps the heat loss. The temperature gradient between body environment. In cold weather, the temperature of the body is higher than the environmental temperature, so the body will lose heat from his body to the external cool environment. And in case of hot weather, the weather will be at higher body temperature than the body, and so the body get heat from the environment. What is meant by conduction? Conduction actually is a source of heat, but its percentage is very low. That is 3% of heat loss. What's meant by conduction? If I put my hand on a substance which is hot, so I will take heat from this substance to my hand. So heat loss is by conduction is the heat loss from warm object to relatively colder one when they are in contact with each other as the closest. The closest is in contact with our body. For example, if I wear a cotton and cotton wet clothes, I can lose heat from my skin to these wetted clothes. Heat loss by this mechanism is minor except when the person is immersed in water. We lose heat conduction by usually in the normal condition in very little percentage. But if a person, for example, is immersed, is put his body in a cold water, at this moment he will lose excess of heat by the cold water. What's meant by convection? Actually, convection is heat loss through air current. How? That the air current, as I have said, the layer of air on contact with the skin become worser and lighter, and this will ascend, and the fresh air takes into place, which become warmer and ascend, and so on. So the heat current helps the loss of heat from our body surface, and equal the percentage of heat loss by convection equals 12%. But usually the air current in our life is of minor importance because usually there is no air current in our environment except when there is a cold winds, and this we call forced convection. Radiation, 60% of our heat loss is caused by radiation. So it is mostly that our body loses heat by radiation. Scientists said that any warm object or any object which is not at absolute zero body temperature can emit heat in the form of electromagnetic infrared rays. So our body usually emit heat as electromagnetic infrared rays, and so the heat loss by radiation is heat loss from a warm one to relatively colder one, but it is not in contact with each other. And one of the most important radiator surface in our body, or radiator object in our body, is the sun. Then by evaporation. Evaporation means evaporation of water from the body surface. This is caused by insensible perspiration and by sweating. Usually, how the body loses heat by evaporation? That is, each 1 gram of water to be evaporated, it needs 0.58 degree of calorie, 0.58 calorie to be lost from the body, about 0.6 calorie to be lost from the body. So in order to evaporate, for example, the sweat, each gram of water needed to be evaporated, it takes with it about 0.6 calorie lost from the body. That is how the evaporation decreases the body temperature and causing loss of heat. There are 2 types of evaporation: insensible perspiration. Insensible perspiration, it is like the plant that usually all the time will lose heat from our body surface, even if the environment is constant, not so cold, not too so hot. So it is usually a continuous passive process. So about 25 to 50 milli of water are continuously evaporated from the skin and lung each hour. What is the source of this water? Is actually the blood flow to the skin surface. So this it represents about 20 to 25% of our basal metabolic rate. So we can set a multiple choice question at comfortable zone of external temperature 20 to 25 degree. The heat loss occurs by radiation 60%, conduction and convection 15%, insensible perspiration 25%, and no sweating. Why I said no sweating? Because usually sweating occur in certain conditions only. What are the center conditions in which the heat loss occur by sweating? So this is our regulation, the mechanisms of heat loss: conduction, convection, irradiation, and insensible perspiration under normal body temperature. And then in hot weather or during muscular exercise, the heat loss increase by sweating. So how this balance is maintained? يعني the balance of heat production and between heat production and heat loss is maintained. This is maintained by a very precise and very powerful heat regulating center. Then before discussing the heat regulating center, we have some means in our life which we can by it maintain our body temperature. That is the behavioral thermoregulation. It means the conscious use of shelters, air conditioned clothes to live in the most extreme climates. Yani for example, in cold weather we put excess clothes and may use a heater, and in hot weather we may use shelters, air conditions, fans, and light clothes. Okay, this the importance of the behavioral thermoregulation. It reduces the thermal discomfort, and also it minimizes the effect of this stressful thermal stimuli on the physiological thermoregulatory system. Then we have the physiological thermoregulation. It is very fine adjustment of the heat balance by and the body temperature. Actually, this thermoregulatory system work by a reflex arc by receptors afferent, center, efferent, and effectors. The receptors of the physiological thermoregulatory system, we call it the thermoreceptors. There is a central thermoreceptors and a peripheral thermoreceptor. The central thermoreceptors is present in the brain, where in the preoptic area at the anterior part of the hypothalamus. As it is a thermoreceptor, it must include heat and cold sensitive neurons. So the heat sensitive neurons increase their firing rate when the body temperature increase, while the cold sensitive neuron increase their firing rate when body temperature decrease. So these thermoreceptors are present in the brain. So how information get to this central thermoreceptor? It is by the blood supplying the internal organs. This blood which supplies the internal organ become heated by the temperature of the body, then it returns this temperature to the brain, to the preoptic area where heat and cold sensitive neurons. Usually it has more heat than cold sensitive, so usually it prevents the high body temperature more than the low body temperature. However, the peripheral thermoreceptors, which are located in the skin, also they are warm and cold, by in contrast to the central, it has 10 times more cold than warm receptors. Okay, they are found يعني في superficial present in the skin, و deep found in spinal cord, the abdominal viscera, and around the great vein. Usually the information from the peripheral receptors, if you have take in the CNS, that is transmitted by C and A afferent fibers to the lateral spinothalamic tract, to thalamus and the hypothalamus, and prevent low body temperature. So the reflex arc is as follows: receptors and afferent. The afferent pass to a heat regulating center. The heat regulating center, we call it the hypothalamic thermostat because it is adjusted as a standard critical temperature, which we call the set point, that is from 36.6 degree to 37.2 degree. Its location is in the hypothalamus. The function of it is that it detects any deviation from the body. It receives information from the thermoreceptors about our body temperature, and if as our body temperature is different from the set point, it sends information to an effector organ to take a response. So again, let us talk about the heat regulating center. We have a heat loss center or anti-rise center, and the heat gain center, anti-drop center. The heat loss center is present in the hypothalamus, the anterior hypothalamus, and the heat gain is present in the posterior hypothalamus. As it is a heat loss or anti-rise center, it is activated by increased core temperature, and the other, as it is anti-drop center, it is activated by decreased core temperature. Okay, as it is stimulated by increased core temperature, so the impulses reach it mainly from the central thermoreceptor, as we have said, and the heat gain or anti-drop receives more from peripheral thermoreceptors, as we have said. The chemical transmitter in heat loss neurons is norepinephrine, and heat gain neurons is serotonin. And the effect, we will call it now. What is the effect? When the heat regulating center or the thermostat detect any deviation from the body temperature from the normal body temperature, it sends the impulses to effector organ to take response in order to adjust the body temperature. The first effector organ is the skin. The skin contains cutaneous blood vessel. The cutaneous blood vessel, if the cutaneous blood vessel become constricted, يعني vasoconstriction, the temperature, the diameter will decrease, and the heat flow to the skin will decrease, so the process of heat loss will be decreased. And the contrary, if it is dilated, the blood flow to the skin will increase, and the temperature of skin increase, so the heat loss increase. So the cutaneous blood vessel in the skin is affected by sympathetic vasoconstrictor fiber, which changes the diameter of this cutaneous blood vessel, so changing the blood flow to the skin, thus maintain heat loss or gain by the non-evaporative mechanism, which is conduction, يعني the mechanism of heat loss, conduction, convection, irradiation. Then we have an important structure, which is the sweat gland. The sweat gland is supplied by sympathetic cholinergic fibers. How sweat evaporation? Okay. We have said that each 1 millisweet to be evaporated, it causing loss of 0.6 calories. And usually this affected by air current. It is increased by air current, sweet evaporation, humidity. In case of humidity, the sweet evaporation is decreased, and the environmental temperature in hot water, the sweet evaporation increase. We have also the piloerector muscle. The piloerector muscle contract in cold weather, so causing air erection, and this is a mechanism of decreased heat loss, as the air trapped between the hair prevent heat loss is act as an insulator. The skeletal muscles are supplied by somatic nerves, and usually it is a mean of getting heat production by its contraction and by the muscle tone. And then we have the endocrine glands. Some hormones are thermogenic hormones that they increase the tissue metabolism, such as the hormones of the adrenal medulla and the thyroid gland. So usually in cold weather, the secretion of adrenaline and the thyroxine increase, so it increase body temperature to prevent the decrease with cold climate, and then decrease on exposure to hot climate. We have a special fat which is called brown fat. These brown fat are highly vascular fat, and it is present in excess in the newborn. It is usually situated between the scapula and around the intra-abdominal blood vessel. This brown fat has, when they are stimulated by the sympathetic nervous system or noradrenaline from the sympathetic nervous system, these stimulate lipolysis, which give free fatty acid, and then the free fatty acid is oxidized and on the mitochondria, which will lead to heat. This heat will be distributed to the rest of the body, but usually it is of major importance in newborn but of very limited importance in adults. So it increases the basal metabolic rate but 2.5 times the resting value. Physiological regulation of body temperature. That we have three zones. At first, the thermoneutral zone. This is from 4 to 32 degree. This is a comfortable zone, but also it is a comfortable zone, okay, but within this range also the body temperature is maintained constant. But usually this is by means of the blood vessels going to the skin by the regulation of their diameter. So if the body temperature tend to increase, for example from 24 to 32 degree, this stimulates the hypothalamic anti-rise center. The anti-rise decreases the sympathetic tone to the cutaneous blood vessel, leading to vasodilatation, and this increases the skin temperature. The increase the skin temperature, so it makes that the skin temperature will be around the temperature of the internal environment. So the heat loss is decreased from the will increase, so the skin temperature will increase above the environmental temperature, and this lead to heat loss and the core temperature is kept constant. If the body temperature tend to decrease, for example from 32 degrees toward 24 degree, the anti-drop center is stimulated, which leads to increased sympathetic tone, their vasoconstriction, decrease skin temperature. The decrease in skin temperature makes the temperature gradient between the skin and the environmental temperature to be less, so the body cannot lose heat from the skin to the cold environment, and thus the core temperature is kept constant. Okay. Then we have an important means that we keep our body temperature on exposure to hot weather. Let us assume that the temperature of the weather is very hot. So the person will get temperature from the environment by conduction, convection, and radiation. And also the heat loss by these mechanisms will stop, because actually our body temperature will be less the environmental temperature. So there is a heat gain and decrease the heat loss, so the body temperature will increase. This stimulates the heat loss center. The heat loss center will send the impulse to effector organ. The first effector organ is the cutaneous blood vessel. So the anti-rise center will cause inhibition of sympathetic center in the posterior hypothalamus by impulses from heat the anti-rise center. So the inhibition of the sympathetic center leads to cutaneous vasodilatation. So the increase in skin blood flow leading to increase our skin body temperature. And by this way the blood is transmitted from the internal or the deep veins which come from the internal organs, which carry temperature from our body system, from this deeper structure to body surface, so increasing the skin temperature. Thus by this means, as I have said, the heat gain decrease and there is increase in heat loss. Then another means that the body temperature is maintained during exposure to hot weather is by sweating. Let us talk about sweating, as we have said, occur in hot weather and muscular exercise. It also occur in shock. and the mechanism that in shock بيبقى it is a stress because the tissue will be ischemic. This stress stimulates the sympathetic nervous system, and as sweating is supplied by sympathetic cholinergic fibers, so the sweating will increase. Let us discuss the number of discuss the sweat glands. Their numbers is about 2.5 millions in our body, and it is composed of a deep coiled portion which secretes sweat or precursor secretion, and the duct portion which pass out. This is the deep coiled portion which is supplied by sympathetic cholinergic fibers, and the duct portion which pass to the pore to the outside. Let us say that this coiled portion will secrete the primary secretion or the precursor of the sweat, and then this precursor actually is altered during its passage through the duct. That is, there will be absorption of sodium and chloride ions while secretion of potassium and bicarbonate. So usually the amount of sodium and chloride passing from the duct to the outside is more than its amount in the coiled deep portion of the gland. So this is again that there is alteration of sweat constituent as it flows through the duct. The precursor secretion is secreted from the secretory portion. Then the constituents are altered as it flows through the duct. Low rate of sweat secretion. At low rate, it means that there is a very slow movement of sweat through the duct. So the duct portion of sweat have the chance to absorb more sodium chloride, and at this time, and the reabsorption, it means that the sodium the reabsorption means that the sodium chloride pass from the duct to the blood. So under low rate of sweat secretion, there is a chance for the sodium chloride to be absorbed to the blood. So the sodium chloride in the duct will be decreased to 5 milliequivalent per liter. At increased rate of sweat secretion, it means the sweat passing very rapid through the duct. There is no chance for absorption of sodium chloride. Thus, the sodium chloride increase in the duct to 60 milliequivalent per liter. The composition of sweat, it is the most diluted fluid. Let us remember that all the sodium chloride is reabsorbed mainly through passing into the duct. So the fluid will be hypotonic and the most diluted fluid in all bus. So it is diluted, its specific gravity is low, 1001 to 1006. It is somewhat acidic, its pH is 3.5 to 6.5, and this is because of presence of lactic acid. It is composed like any fluid in our body, which is composed mainly of water, 99.2% water and 0.8% solid, usually 0.5% sodium chloride, 0.3% lactic acid, and 0.02% urea. And also in shock, it contains potassium, and this potassium is released by the ischemic tissue in case of shock. The rate of sweating in cold weather, it is 0. In very hot weather, it may be increased to 1.5 liters or 2 liters. So what are the types of sweat glands in our body? We have eccrine glands and apocrine glands. Actually, the apocrine glands, which is present in the axilla, groin, perianal region, mammary areola, they have no function as regards the regulation of body temperature, but actually is work as a means of sexual attraction in some animals. And they are supplied by adrenergic sympathetic fibers. Then we have eccrine glands, which are widely distributed all over the body and supplied by cholinergic sympathetic fibers, as I have said. But these glands are usually important in the regulation of body temperature, in contrast to the apocrine glands. So what is the mechanism of sweat secretion. That is the increased body temperature stimulates the anterior center, anterior hypothalamic nucleus, then impulse is sent by reticular formation through the reticulospinal tract, through lateral horn cells in thoracolumbar region, sympathetic outflow to the sweet gland. Usually the accompanied vasodilatation of you see someone which is present in very hot weather, you will find his face that is flushed, and it is red. This is due to vasodilatation of blood vessel, and this is called by direct effect of heat the blood vessel, reflex from heat receptors, or increase the body temperature. Hypothalamus inhibits the vasoconstrictor center and the bradykinin, which is secreted as a result of sweet gland activity. So again, we are talking about the mechanism of regulation of our body temperature in hot weather. We said that there is increased heat loss, also there is decreased heat production. The heat production is by inhibition of the release of the thermogenic hormones, as we have said. Also the muscle tone. The muscle tone is an important means for inhibition of production of heat. Loss of appetite and anorexia. Usually in hot weather, we prefer to drink water or soft fluids than eating, because usually the food stimulates the heat production by its specific dynamic action. Let us talk about the exposure to cold. It is usually the contrary of the effect of exposure to hot. In cold weather, the temperature of the skin will be higher than the temperature of the environment. So heat loss will occur from the skin to the environment by conduction, convection, and radiation. So the body temperature will decrease, and this stimulates the heat gain center of the posterior hypothalamus, and thus it maintains the thermostasis by increased heat gain and decreased heat loss. How there is increased heat gain? By increasing heat production, and this is achieved by increased muscle tone. And this is its center is present in the posterior hypothalamus. The increased muscle tone, when it reaches a certain critical level, it produces a certain process which we call shivering. So what is shivering? Shivering is non-rhythmic stimulating signal downward through the reticulospinal tract to the anterior horn cell, and this will increase the skeletal muscle tone and increase the body temperature. Actually, after increasing the muscle tone above a certain critical level, the impulses will be transmitted to usually the reticulospinal tract, supply both the gamma motor neurons and the alpha motor neurons. The alpha motor neuron will cause the muscle to contract, and also the gamma motor neuron, when it reaches a certain critical level, it will stimulate the muscle spindle stretch reflex, and there is feedback oscillation, yani from the muscle spindle to from the gamma motor neurons to muscle spindle, then to alpha motor neurons, that increase muscle contraction, and the process is repeated. Stimulation of gamma motor neuron, then muscle spindle stimulation, then stimulation of alpha motor neurons, then muscle contraction, and this we call the feedback oscillation of muscle spindle stretch reflex, leading to what we call this non-rhythmic process, tremors, non-rhythmic tremors, which we call the shivering. Normally, the shivering increases the heat production by 400 to 500%. Its center is stimulated by cold signals from the skin and inhibited by signals from the preoptic area. Actually, they must be stimulated by cold signal, and actually it must be inhibited by the anti-rise center, because because in case of anti-rise there will be decreased heat production. Okay, shivering is abolished by alcohol. The alcohol depresses the vasomotor center, leading to vasodilatation. increase the skin temperature, so delay the stimulation of shivering, and in alcohol inhibits spinal anterior horn cell. The curer blocks the neuromuscular transmission and depresses the muscle tone. So as the curer blocks the neuromuscular transmission, and actually the shivering and the muscle tone require this neuromuscular transmission, so it abolishes the shivering. And it is increased by ingestion of cold food like ice cream, which therefore is better to be ingested during winter than during summer. Again, I wanted to say again the mechanism of shivering. Actually, you can remember the reticulospinal tract, which is originated from the posterior hypothalamus. You can know that this is a stimulatory tract for the gamma motor neuron. As the gamma motor neuron is stimulated, the muscle tone will be increased. And also the reticulospinal tract sends the impulses at the same time to the alpha motor neurons. So stimulation of the alpha motor neurons leading to muscle tone and also increase, and also the gamma motor neuron leading to muscle tone increase. And then the process will be make a visual circle, or that the muscle tone will increase and decrease, increase and decrease. This is what we call the non-rhythmic muscle tremors. Also, the increased yield production in case of cold weather is caused by increased secretion of thermogenic hormone, stimulation of the posterior hypothalamus, increased secretion of thyroxine, adrenaline, noradrenaline. This increases the heat release, and also increase the sensation of hunger and appetite. The decreased heat loss is by the cutaneous vasoconstriction. This cutaneous vasoconstriction, that is the antidrop center, which is the posterior hypothalamus, stimulate the sympathetic tone leading to vasoconstriction. So the skin temperature will decrease. As the skin temperature is decreased and the cold weather is decreased also, so the heat loss will be decreased. There is something which we call the counter current heat exchange mechanism. That is, the heat is transferred from hot arterial blood to cold venous blood as it returns to the heart. What's meant by? Usually, counter current, it means that are two systems which pass in parallel and in opposite direction to each other. The heat is transferred from the internal organs via veins to the skin, and is transferred yes, and usually these veins run parallel to the arterial blood. During the run parallel to it, heat is transferred from veins to this arterial blood. The hot arterial blood will return to the body and then maintain the body temperature, while the venous blood, where it passes to the skin, it will be cold. Thus, the temperature of the skin will be decreased, so there will be no heat loss. Curling up like a pole, this decreases the surface area, so decrease the heat loss. Erection of hair, we have said it. Clothes, if we put on more clothes, there will be two air trap, one in the meshes of the clothes and the other between the inner layer of the clothes and the skin. So several layers of clothes produce several air traps. So the persons who live at aquatic، يعني زي خط الاستواء مثلا، وفي الاسكيمو، الناس اللي عايشة عند خط الاستواء، how they are adapted to hot weather. There is adaptation of the physiological thermoregulation to prolonged exposure to hot weather. The adaptive mechanism includes increase the skin blood flow, the blood flow to the skin is increased by the threshold for cutaneous vasodilatation is reduced. This means that vasodilatation will occur at lower body temperature at lower body temperature than normal. So it is maintains the heat transfer from core to the skin. In cold weather, what is meant by adaptation or acclimatization to cold weather? It is adaptation of the physiological thermoregulation to prolonged exposure to cold weather. The adaptive mechanism includes that in contrary to the acclimatization to hot weather, the skin cutaneous, there will be no vasodilatation but cutaneous vasoconstriction. Also, the counter-current heat exchange mechanism between veins and arteries will be improved, thus decrease the heat loss from the skin. Also, acclimatization to hot weather include increased sweating. That sweating begins earlier and at lower core temperature. This is because the sensitivity of the sweat gland to cholinergic stimulation increases, thus increasing the sweat rate. Also, the sweat gland becomes resistant to fatigue. Also, there will be increased secretion of aldosterone, because actually increase the sweat rate at this zone will causing depletion of sodium, and this is dangerous. So the increased aldosterone secretion will increase the sodium reabsorption from the duct of the sweat gland, and this decrease the sodium concentration in the sweat, which will be equal 5 milliequivalent per liter. In case of cold weather, there is increased secretion of thermogenic hormones, while in hot weather there will be decreased secretion of thermogenic hormones. Actually, this person also have a mean of maintaining their body temperature by behavioral thermoregulation, like using fans, air conditioning, light cotton clothes in hot weather, and the using of air conditioning also and heavy clothes in cold weather. We have said that the heat regulating center maintains the body temperature as a critical level or the set point. So one may ask himself that, so the body temperature will not raise or decrease at all? No, there is some cases in which the body temperature increase, which we call hyperthermia, and some cases in which the body temperature decrease, which we call hypothermia, and some cases such as a fever, as occur in typhoid fever, for example, or any bacterial or viral infection. The hyperthermia, what's meant by hyperthermia? Hyperthermia is an increase in body temperature without a change in the set point of the hypothalamic thermostat. What is the change in the set point of the hypothalamic thermostat? This is what, so it will be discussed during discussion of fever. When we get hyperthermic, for example, in case of prolonged severe exercise, actually the heat production during exercise may increase very much during prolonged severe muscular exercise, which may be lethal, may lead to death. Or impaired heat loss, increased environmental humidity. In hot weather, if the weather is humid, so the heat loss by evaporation will be decreased very much, and this causing impaired heat loss during hot environment, so the body temperature will increase very much. Or in case of excess environmental temperature, an example, the infant which is placed in closed car in hot weather. Actually, we have three categories of hyperthermia. First, we have the heat cramp. So can you see a football player that he developed a very painful muscle spasm? You can see him. So the heat cramp is a slow and painful skeletal muscle cramps and spasm. Usually it appears in the most heavily used muscle. You can see him that it appears in his lower limbs, which he used during the football playing, and not his upper limb. It lasts for 1 to 3 minutes. they said that it is due to salt depletion. Usually you see him that he drink excess of water during playing without salt, and this leads to this cramp. The body temperature may be normal or slightly elevated. This is because there is a sweating which prevents the rise of the body temperature. We have another category which we call heat exhaustion. The heat exhaustion, it is as a result of overactivity in hot environment, and this leads to marked increase in heat production, increased body temperature, stimulation of excessive hot loss mechanism. Actually, heat exhaustion is a state of collapse in the form of fainting due to high potential. Why? Overactivity in hot environment will lead to excessive sweating, so the blood volume will decrease, and also there is vasodilation in the blood vessel, so the blood pressure will be decreased. It is caused by depletion of plasma volume, secondary sweating, extreme vasodilation of skin blood vessel, so the blood flow to the brain will decrease, this leading to fainting attack. Usually the body's temperature not elevated markedly due to loss of heat by the excessive sweating occur in such a case. Type. What is the heat stroke? The heat stroke is a more dangerous condition than heat exhaustion, and it may be due to an end stage of prolonged untreated heat exhaustion. This prolonged untreated heat exhaustion leads to dehydration and impaired cerebral circulation, and as the heat regulating system is present in the brain, so the impaired cerebral circulation leads to the failure of heat regulating system, so the temperature will become more and more. And its cause is mainly the overactivity in hot environment, as we have said in heat exhaustion, but the difference in such case that the environment will be also humid, so the evaporation of sweat by the evaporation of sweat will be lost, so the heat loss mechanism by sweating will be lost also. It will be characterized by he will be collapsed or fainted. He may develop convulsions, he may develop and failure to sweat, and prolonged unconsciousness. What is the treatment of heat exhaustion and heat stroke? The treatment is cessation of this activity, which he do in the hot environment, fluid replacement, and external cool. There is another stroke which we call sunstroke, and it is usually due to this the same as heat stroke, but occurs mainly due to prolonged exposure to sun rays, and it is fatal if not treated, and it's a treatment like heat stroke. So we have something which is common to occur with us if we get bacterial or viral infection. This is we call the fever, and the fever is elevation of body temperature. But in contrast to hyperthermia, it is due to resetting of the hypothalamus thermostat. What is meant by resetting? We will say it now. Usually we get fever if we get infected by viral or bacteria. The physical trauma, someone who get a trauma like broken leg or anyone, he will be feverish because of increased metabolism due to the wound effect. And also stress tends to increase the sympathetic nervous system, which will increase the sympathetic tone. What is meant by resetting of the hypothalamic thermostat? The bacteria or viruses are ingested by macrophages, and the net result of digestion of the bacteria or virus or their toxins, there will be release of some endogenous pyrogen, which they said that they may be group of peptides, chemical mediators like interleukins and so on. This pyrogen, when it reaches the brain, it acts on the hypothalamic thermoreceptor. Then the hypothalamic thermoreceptor, their input to the integrating center will be altered. This resets the thermostat at a new higher level. What's meant by that? If the thermostat adjusts the body temperature at 37 degrees, it may adjust the body temperature at 40 degrees. Okay, and they said that the mechanism is the local synthesis and release of the prostaglandin within the hypothalamus. يعني the hypothalamic thermoreceptor alters the input to the integrating center, and the resetting occurs mainly by release of prostaglandin. So usually if we get feverish, we take aspirin, as the aspirin inhibits the prostaglandin and decreases the fever. They said that it is important somewhat because the interleukins like interleukin 1 and other peptides enhance the resistance of the host to infection and promote healing of damaged tissue. What are the stages of fever? Let us remember that you have a common cold. At first you will feel very cold sensation, and you will put on many clothes, and you will get a shivering, يعني tremors or chills like this. So what is the stage of cell? It means that the resetting of the hypothalamic thermostat to a new level above 37 degrees. That is, the set point will be 40 degrees. However, our body temperature is 37 degrees. So the hypothalamic heat regulating center will interpret this body temperature as comparison to the set point that the person is exposed to cold, and this is a false sensation of to cold. So this will stimulate the anti-drop center and the anti-drop mechanism, which decrease the heat loss by cutaneous vasoconstriction and increase the heat production by shivering. So you will see his skin pale due to vasoconstriction and cold due to vasoconstriction, and at this time you will put on more clothes. Then the stage after it is the steady state of fever. That is when the temperature reaches the new set point, that is the temperature of our body, because of release of thermogenic hormone, because of putting on clothes, because of the shivering, because of the vasoconstriction, so the body temperature will reach the set point, which is 40 degrees. At this time the shivering stops and we feel warm, and the vasodilatation may occur, not vasoconstriction, this is wrong, and the skin will be warm and flushed. The stage of effervescence, you can remember when you take antipyretic and antibiotic or antiviral, at this time you will get sweet and you will put off the clothes and the covering you have. So at this time you may say that you will recover. Removal or treatment of the causative factor, the set point drop. So the mechanism of this, that the body temperature is 40 to 40 degrees. Then you take antipyretic or antiviral antibacterial, so the set point will be decreased. So the body temperature will be higher than the set point. So the anti-drop dry center will be stimulated and evoke the mechanisms which decrease the body temperature. That is cutaneous vasodilatation and sweating. The fever has a benefit, yes. It increases the production of antibodies, it prevents the growth of certain microorganisms, and prevents the growth of certain tumors. Then lastly we have the hypothermia, that is, it is decrease of body temperature. Its causes is the prolonged exposure to cold weather, the immersion in cold water, or during anesthesia, because anesthesia may depress the hypothalamic thermostat and also is relax the muscle, and we have said the muscle tone is important for maintenance of body temperature. Actually our body can maintain temperature from 21 to 24 degrees without any permanent ill effect. At the hypothermia, shivering is prominent at mild hypothermia. It decreases in moderate hypothermia. It is absent in severe hypothermia. Why? Because in severe hypothermia, at this time, the neuromuscular junction actually will be depressed in case of severe hypothermia, so the shivering will be decreased. The character. The decreased body temperature will depress all the physiological systems, especially the CNS. So our body systems usually act at the normal body temperature, 37. Any drop will depress this system. Let us remember, if the heart is present outside the body or a muscle, then I put cold drops on it and then record its contraction, the contraction may stop. So there will be decreased heart rate, decreased arterial blood pressure, decreased respiration. Also the renal tubules will be depressed, so impaired sodium reabsorption leading to dehydration. And the cause of this such condition is a stop of respiration and heart failure. Sometimes the hypothermia is used by surgery in order to reduce the bleeding and minimize the bleeding during the operation. So surgical use the process of hypothermia in case of brain surgery and open heart surgery. If they make an artificial hypothermia, so the circulation can stop for a long period of time and with decrease in oxygen need of the tissue. Actually, the hypothermia will depress the metabolism of the tissue in which the surgeon act on, and this depression of metabolism causing them decrease their need of oxygen, so the blood flow can be decreased without minimal effect, and the bleeding will be minimal because the hypothermia produces vasoconstriction. Its treatment is by application of wet heat, hot fomentation, because water is a good conductor, and then restoring the fluid and the acid base balance and the electrolyte.